Hi everyone, it's Dr. Jeff here. Today we're actually talking with Bettina here. Bettina, how pregnant are you?
7 months.
So in 7 months, Bettina is going to give birth, and she has a few questions for us on what do we do with a baby and chiropractic. So what kind of questions do you have for me?
I would like to know, how safe and how soon after delivery can we adjust the newborn?
Well, my last child, my youngest, Rachel, was actually born at home with a midwife, and I actually treated her probably within a couple minutes of being born. So, the sooner we treat them, the better. There's no real time frame for that. How safe is it? Well, babies don't have joints like we have joints yet. It's very soft tissue oriented. So when I adjust a baby, it's very gentle. It's more like this. Mm-hmm. All right. So usually when mothers come in, I'll put the baby up on the mother's shoulder, and I actually will palpate through their neck and their back, and as I'm palpating, I'm actually adjusting them. So quite often the mother doesn't even know what I've done, mm-hmm. Because there's not a real quick thrust or any cracking noise or anything like that with adjusting a baby.
Okay. Why would I want to have my newborn adjusted? Are there some common conditions that are treated?
Well, when a baby's born, the first thing that comes out is the head. And when the head comes out, they have to get the shoulders out, and the shoulder is kind of the widest part. In order to get the head out, what they do is they tilt the head up, and they try and pull the bottom shoulder out. When they do that, they use some force, and what can happen is the upper cervicals here will then have a tendency to get rotated to the side. The other thing that happens is the baby's kind of rolled up inside you, tucked up inside you, and one of the things they do is they want to see how long the baby is, so they actually take the baby, your child, and they actually stretch them out on the bed or on a counter, and they actually see how long they are. And what happens is, one of the big things that happen is that is colic, and what they have found is that the nerve that actually makes the stomach actually turn on comes from your neck, and the nerve that makes the stomach turn off comes from your mid-back. So if something's out of whack up in here, or something's out of whack in the mid-back, that can actually affect your child's stomach, and that kind of leads to colic. So you get a baby that cries all the time. You don't understand why it's crying all the time. So what we do with chiropractic, we can go in there and we can actually get those vertebrae back where they're supposed to be, get the back working properly. And research has found that we can take a baby that cries more than 14 hours a day, we can get down to less than 4 hours a day within 2 or 3 adjustments.
That's great. How is a newborn adjusted?
Well, as I mentioned, generally it's done very, very gently. There's no big manipulations. I'll either hold on to the baby myself, and sometimes I'm holding them, if they're just new, I'll just hold my hand like this, and I actually just palpate down with my thumb this way here, just kind of gently moving things. Or I'll have them up on their mother or father's shoulder, and again, just taking my fingers and moving down like this, and again, just gently moving things like that.
Are there any risks to having my newborn adjusted?
There's no more risk than yourself getting adjusted, or a 12-year-old child getting adjusted. We're not going to break anything. There's no real contraindications. Mm-hmm.
And how often should my child come in for adjustments?
Our office here, what I like to do is I like to see them when they're first born and make sure everything's in line with them. And then usually when they start to hold their head up, again, I'll check to make sure that everything's in line with their neck and their shoulders. Then once again, when they start to sit up, and also when they start to walk, they start to do the cruising thing, we want to make sure their hips are in line. Other than that, in the first year or so, generally if they're getting lots of ear infections, or they're getting sick, or they're colicky, you drop them. They fall down the stairs. We'll get them in. And after the first year, generally kids respond really well to chiropractic. They take the adjustments really well. So I won't see them. I'll see children and kids. I'll see maybe 3 or 4 times a year. Mm-hmm. Again, unless they're having some issues, we'll see them more often. But they respond so well to chiropractic, I don't need to see them more often than that.
Right. Okay, I think that's everything. Thank you very much.
All right. Mm-hmm. Thank you for listening. It's Dr. Jeff. If you have any questions, you can send me an email at jgoldsworthy@goldsworthywellness.com. If you like the video, share it with your friends.